everyone, I'm Natalie Kunzman, MD, and today we are going to talk about the Delta variant of COVID-19. And we're going to take all fear away from this topic, get the facts, get empowered, and anxiety and fear will not help us moving forward. And I think it is unnecessarily exploited in some of the media right now. So again, let's get the facts. And I need to give credit where credit is due, that Mike Mutzel has been sharing some of the same information I have extracted in my search to really make heads or tails of this variant. So what is the Delta variant? Well, it is the variation of COVID-19 and the traditional or initial COVID-19 that we all have been exposed to in the early part of the pandemic was the Alpha. Now, the Delta portion has been given a name, first of all, in its Latin form so that we can delineate between the two, but it also is talking about the subunit on the spike protein that is different than the subunit on the spike protein of COVID-19 alpha, and that will refer to B.1.617.2. Again, that's a mouthful, and that is for the scientists. But again, the spike portion of the COVID-19 virus has changed or is different in some strains, and this Delta variation is what really took off in India and to a degree in Britain. And currently it's not the primary strain that we have in this country. However, I can at least attest for Colorado right now in the new cases, it is about 10%. So it is not a small player. So what is it about this Delta variant that we think might be a little bit different than COVID-19 alpha or the original strain? Well, some of the symptoms of the Delta variant may be a little bit different, such that some of the fever, headache, and the sore throat and runny nose are common and similar between the two, but cough and the loss of smell are not. Now, what is the biggest worry about this Delta variant that we have been hearing? Well, one of the proponents is that this is a much more catchy virus. And yes, indeed, it does seem to be a lot more quickly transmissible, seems to make a lot of viral copies. But reassuringly, and so far what I am reading, and this is mostly the British literature, which I will share with you in a graph form, is that the lethality of this virus is less than what we are seeing with the COVID-19 alpha variation. So if you look at the graph I am providing for you at this point, we are comparing the 219,000 plus alpha variations of the COVID-19. And if you look forward to the column that talks about the case fatality, this is 1.9%. We think this data has been collected in approximately the past 4 to 5 months. And again, it's British data because Delta variant is not as predominant in the United States just yet. Now, if you look at the other portion of the graph, which is looking at the Delta portion, and in that there were 50,000 plus patients that had COVID-19 Delta, and you move to the deaths column and the case fatality, we are now seeing 0.1% of case fatality. So no death is wanted by any means, and this is not to say anything disparaging about any single death, but please let us focus on the data that is evolving, that is should be reassuring us to a degree that the Delta variant is transmissible, but not as lethal. So, who are those people that are most at risk for the Delta variation? Well, for some of you non-vaccinated people, you may find this an interesting fact that so far we do think that the vaccinated sector has an edge on protecting from the Delta variant. However, it is not as protective as we thought it would be. And there's some stats out there to say that there's about 60% breakthrough, such that if you've been immunized against COVID-19, the alpha variation, which is what we have available now, you may have a 60% chance of getting the Delta variant. But you have the edge on the non-vaccinated people thus far, that you may be less sick and less chance for hospitalization. However, again, for the non-vaccinated people, this strain should be no more worrisome than the initial strain of COVID-19. This does not mean, people, that I'm suggesting we throw caution to the wind. This is, again, a time to buckle down and have some very good practices such as hand washing, potentially some hypochlorous solution when you've had exposures, have a lot of your preventive tactics. Maybe it is time to wear a mask again, maybe it is not, but social distancing has led to a lot of anxiety and a lot of financial disruption in the past year in the epidemic, and we've learned a thing or two about what complete lockdown can do and how devastating it can be to any country. So again, now we really need to talk about COVID-19 in general all over again, mostly because we have this new Delta variant to concern ourselves about, and who in the end made their way through the COVID pandemic easily and who was at risk. We have found in our hospitalized severe COVID patients that those with the comorbid conditions were those at risk for hospitalization and maybe potentially ICU and or death. The same issue will follow with the Delta variation in the highest risk populations. So I will show yet another graph that has already been shared on several different YouTube channels, but the top 5 comorbid conditions in the pandemic leading to hospitalizations were hypertension, disorders of lipid metabolism, and that would include you insulin resistant patients, obesity, again, that's high up there as a pro-inflammatory condition, diabetes, especially diabetes that has complicating factors, and coronary artery disease. Now, there are several other comorbid conditions that has led to poorer outcomes in the COVID-19 battle, and just beyond the chronic kidney disease sector are the anxiety and fear-related disorders. Again, that is not highest on the list, but it's not low on the list. It is smack dab in the middle as being a comorbid risk factor for this illness. And of course, that means anxiety and panic disorder and depression. These people did not fare as well with the illness. And while I am on this soapbox, the last thing we need from our media, from the leaders we are looking to for guidance, the last thing we need to do is fear people into an immunization, fear people into their masks, making people afraid of visiting family members, especially if they are well, fearing children into homeschooling and not participating in normal social activities. This has really escalated during the COVID pandemic, and I can speak from experience with those people that I am seeing in my office requesting and needing a lot of psychological help and sometimes medical help for these anxiety and depressive related issues. Now, some of the lifestyle factors that have been proven in the literature thus far is movement. So I will say exercise, and those who exercise are having a lesser severity rate in COVID-19 than their cohorts who are not exercising. Vegetable and good eating versus high carb, high sugar diets are proposed to helping this battle. So all is not lost. You are able to affect change with your immune system without even taking the first pill. Sleep is absolutely essential for our immune fight. Vigorous hydration for our immune battles. Again, circling back to the topic of the Delta variant. Of course, more data will be coming out in the United States as our Delta variant cases will be picking up speed. Again, be smart, protect yourselves, but do not fear. Do not presume that we are heading toward a fatalistic recycling of another severe pandemic when it seems to be this catchy variation that likes to hang out and get into our receptors in our body. However, it seems to be far less virulent. There may be other strains in the future. This is the Delta variant. Again, bring a lot of your concerns up with your primary care physician, but you can start today with good health habits, whether you choose to immunize against the top 3 that are available or the Novavax that may be coming out to the market in the very near future that might not necessarily be spike protein dependent for its immunization protection. There you have it, folks. If you have any questions, please do not hesitate to submit them in the box below. Please share your experiences. Do not fear. If there is one thing I could bring to you is to just simply get the facts, get your sources from different areas that are reputable, and do not buy in to anybody who's trying to scare you. I'm Natalie Kunzman, MD. Subscribe to my channel below. And until we meet again, be well.